Hi guys, why are we here today? Today we will be talking about Aspirin Enteric coated gastro-resistant 75 mg tablets and its therapeutic arsenal. Stay with me.
Aspirin will remain the cornerstone of treating and preventing cardiovascular disease for the foreseeable future. This phrase was quoted and merged from the American Heart Association website, which is located in the Aspirin in coronary artery disease paragraph and the conclusions paragraph respectively, and it's marked and illustrated inside the red frame or the red circle, which are in the past decade. Thrombolytic therapy has become the cornerstone of medical management of AMI, acute myocardial infarction, and aspirin will continue to be an important agent in the treatment and prevention of cardiovascular disease for the foreseeable future.
The aspirin, very important drug in a group of non-steroidal anti-inflammatory drugs, which discovered in 1897, and it was used in analgesic, antipyretic, and anti-inflammation with a known mechanism of action. But in 1971, discovered the COX enzyme, which affected by aspirin using by British professor John Van, which get the Nobel Prize after 10 years from this discovery. In 1991, the mechanism of action of aspirin, it was very clear as the following. The phospholipids in our body converting to arachidonic acid by phospholipase A2, and this arachidonic acid converting to many groups of prostaglandins by cyclooxygenase enzyme 1 and cyclooxygenase enzyme 2. Cyclooxygenase enzyme 2 convert arachidonic acid to group of prostaglandin. We will talk about important one, prostaglandin E1, prostaglandin E2, prostaglandin I2. At other side, cyclooxygenase 2 enzyme give us prostaglandin F2 alpha and thromboxane A2. Thromboxane A2 was responsible about blood clotting. This group of prostaglandins has physiological transmitters, and this group has pathological mediators or inflammation mediators. This group of physiological transmitters is it's present in our body a long time, along our life, because the body need it. But in this group, appear with an inflammation only. Is that clear? Aspirin, non-selective COX inhibitors, that is mean inhibit COX-1 and COX-2, block two types of enzyme because aspirin non-selective. Aspirin is salicylic acid derivatives. The source of aspirin is willow tree bark, the parent compound salicylic acid. From willow tree bark, we extract the salicylic acid and converting it to acetyl salicylic acid by chemical reaction. The scientific name acetyl salicylic acid of aspirin. The contraindication of aspirin not be taken by children aged less than 60 years. We will clear it next. The dose tablet by milligram according to clinical uses and common side effect as the following. The classic dose of aspirin 300 milligrams, classic dose. If we take half the tablet of classic dose as 150 for each. Classic dose used in pyretic as antibiotic, analgesic, and anti-inflammation. But if we take half dose of a classic dose, give us 150 milligram, which used in emergency of acute heart attack. If we divided this classic dose a quarter dose, every quarter has 75 milligram for each. This is standard dose from classic dose. The classic dose 300, half dose of classic dose as a standard 150, the quarter dose 75 milligram for each. This standard dose. This for emergency. In acute heart attack, the dose from 40 milligram to 61 milligram for blood, anti-blood clotting only, not more. The dose from 75 milligram to 100 milligram, 75 milligram, 81 milligram, 100 milligram. This for from anti-thrombosis and cardiovascular disease, the clinical uses. But what's the difference between them? The activity of 75 milligram and 81 milligram and 100 milligram, it's same, but difference with side effect. This less side effect, this more than side effect of this, and this more than side effect of this. It's depending on about bleeding in the brain or in the stomach. But this less side effect. But we will take aspirin 75 milligram coated. This rarely side effect because not cause bleeding. for brain or stomach. Is that clear? The aspirin pharmacokinetics. The absorption, aspirin is high and fast absorbed from stomach because aspirin is an acidic drug and the medium of stomach is acidic too. The absorption high and fast. The elimination. The aspirin has downward route to elimination according to the dose concentration as the following. First order elimination, therapeutic dose. In therapeutic dose, first order elimination. Zero order elimination in high dose or toxic dose. All right. Excretion process of aspirin done by kidney. Why? Because the aspirin acidic drug and the medium of the kidney is an acidic too. Aspirin mechanism of action. Aspirin inhibit COX-1 enzyme led to inhibit all prostaglandin which has physiological transmitters. Inhibit COX-2 enzyme led to inhibit all prostaglandins which have inflammatory mediators, and the aspirin has a reversible mechanism which effective long acting on blood platelets, only have irreversible mechanism on platelets because the platelets not have nucleus. The clinical uses and effects of aspirin. Number one, analgesic effect. Number two, antibiotic effect. Number three, anti-inflammation effect. Number four, cardiovascular effect. Five, gastrointestinal tract effect. Number six, hepatic effect. Number seven, hematological effect. This is important one. In aspirin 75 milligram tablets, coated. The analgesic effect, aspirin in a classic dose, 300 milligram, reduce pain, inhibit COX enzyme, which is avoid prostaglandins production by dual mechanism, central and peripheral. Antibiotic effect, aspirin in a classic dose, 300 milligram, reduce the body temperature on baseline level by block prostaglandin E2 production in the brain. The center of temperature of our body is present in the brain, and the aspirin block production process of prostaglandin E2 in baseline. What's the meaning baseline? Baseline if the normal temperature of our body is 37 degrees centigrade. In the fever, maybe 39 degrees centigrade. The aspirin reduces this temperature to a normal base only, not less than 37. And aspirin considering as antibiotic, not like a strong drug which cause hypothermic. Hypothermic converts the 39 degree centigrade to 35 degrees centigrade. This is the baseline not less about baseline. Anti-inflammation effect. Aspirin 2 in classic dose inhibit COX enzyme or cyclooxygenase 2 enzyme, which responsible about inflammatory mediator, which lead to reduce the capillary permeability, therefore reduce inflammation. Number 4 of clinical uses or effect on aspirin, the cardiovascular effect. Aspirin does not touch heart because aspirin may be treatment or share with treatment cardiovascular disease but not touch the heart from where tachycardia, bradycardia, arrhythmia. In general, aspirin does not touch the heart. In gastric intestinal tract effect, in general, the aspirin high absorbed in acidic medium, therefore it's cause 2 types of peptic ulcer as the following. Type number 1, acute gastric ulcer and hematemesis. When taken on empty stomach, when you take an aspirin in classic dose in empty stomach, cause to you acute gastric ulcer and hematemesis. What's the mechanism? By the mechanism which called ion trap mechanism of aspirin. Is our stomach, such as this is gastromucosal cells. This is gastromucosal cells of a stomach. This aspirin in classic dose 300 milligram. When you take it on empty stomach, the absorption high and fast. The absorption was 99% by gastromucosal cells. The pH of gastromucosal cells 7.5 pH. Natural pH or natural medium, but in the stomach the pH sometimes 2 pH, 1.5 pH, 0.5 pH in case of acute gastric ulcer. All right. The aspirin absorbed by gastromucosal cells and inside the cells and take positive charge and its ionization process occur for it. After that, the aspirin cannot outside from this gastromucosal cells, but stay here, therefore cause acute gastric ulcer. This mechanism is called ion trap mechanism of aspirin. Therefore, you must take aspirin in classic dose within or after meal, within or after breakfast or lunch or dinner. The type 2 of peptic ulcer, chronic peptic ulcer with simple bleeding. When take aspirin tablets with or immediately after food for long time as low dose. If you talk aspirin 75 milligram uncoated for long time with or immediately after food cause chronic peptic ulcer and simple bleeding because it's uncoated. How? What's the mechanism of it? This stomach. This mucosal membrane of stomach be like this shape. When we talk low dose of aspirin for long time, this mucosal membrane become like that, thin layer only. And this causes chronic peptic ulcer with simple bleeding. The clinical uses number 6 of the liver effect cause liver injury and Rice syndrome. This Rice syndrome, we talked before, the aspirin contraindication not be taken for children less than 60 years old because maybe cause Rice syndrome. Rice syndrome cause damage for liver and brain and dead. The patient dead in same day. But this rare, 1 per 1,000. Okay, the important one of clinical uses of aspirin, hematological effect, aspirin 75 milligram, it's anti-thrombotic. Aspirin inhibition aggregation on liver platelets by 3 mechanisms. Anti-platelets. First one, inhibit COX-2 enzyme which lead to avoid thromboxane A2 production. Thromboxane A2 is most important mediator which lead platelet adhesion with its together and cause aggregation. Thromboxane which present in platelets. These platelets contain cyclooxygenase 2 or H and production thromboxane A2. This most important for blood clotting. Let platelets clotting which together. But aspirin avoid adhesion of this platelets. Let's them like this. Second one of mechanism, aspirin is acetyl salicylic acid, cause acetylation for cell membrane of platelets which lead to avoid platelets adhesion with H together. Cause acetylation for platelets and avoid adhesion which together. Third one or final one of this mechanism, aspirin inhibits synthesis important mediators which called adenosine diphosphate and therefore avoid platelets aggregation and adhesion like that process which happen in the wounds. Or more difficult picture. All right. This cross section of blood vessels. This is endothelium laning. This is endothelium laning. This endothelium laning contain cyclooxygenase enzyme 1, which production prostaglandin I2. And the platelets in blood current, they are present in the center of blood current, in the center of blood vessels, not here or here or here, but in the center, to avoid blood clotting or to avoid thrombosis. Platelets contain cyclooxygenase 2, which production thromboxane A2. This very important for blood clotting. This very important for anti-blood clotting or anti-thrombosis. But we talk aspirin. We will block cyclooxygenase 1 and cyclooxygenase 2. But what is the suitable dose to avoid block this COX-1 and avoid non-production prostaglandin I2? What is the suitable dose? The suitable dose is very low dose of aspirin, which is 75 milligram, because the platelets more sensitive to lower dose of aspirin, which is 75 milligram. 75 milligram of aspirin block COX-2 enzyme only by irreversible mechanism. Is that clear? All right. Aspirin 75 milligram inhibit COX-2 inside platelets only without any effect on vascular endothelium. And this important mechanism, which led aspirin 75 milligram can also be used after bypass surgery. 75 milligram aspirin has a reversible mechanism of platelets, and this same mechanism which aspirin 75 milligram has on cancer prevention. A reversible mechanism, the action is due to aspirin property to inhibit COX platelets do not synthesize new protein, but endothelium cells do. Blood thinning by the dual mechanism inhibit platelet aggregation, inhibit prothrombin, which is clotting factor. Primary prevention, take aspirin tablet 75 milligram before incident. What's the difference between primary prevention and secondary prevention? Primary prevention for persons, healthy persons, not have any disease, about cardiovascular disease or diabetic mellitus, whatever. But in secondary prevention, for patients which already suffering from cardiovascular disease or thrombosis, how we can know what the person need? Talk aspirin 75 or what? Okay. 9 years cardiovascular risk score, heart risk calculator. As a global guidelines, you can write this title in Google engine to get the website which you can calculate some data of you, to you can know you must be take aspirin 75 milligram or not. Data entry parameters, enter your data, numbers of lab test result, and other information as the following. Enter your age, your gender, smoker, blood pressure, blood cholesterol, and blood sugar. Finally, submit the calculate bottom to get the final result. In website for calculating like this, your age, your gender, blood pressure, systolic blood pressure, systolic blood pressure, and finally submit this bottom to get the result. If the result about it was 25%, that is mean this person may be suffering from cardiovascular disease within next 10 years. If the result was more than 20%, this person must be take aspirin 75 milligrams daily. If the result more than 20%, that is mean the risk level above 20%. Therefore, this person must be take aspirin 75 milligram daily. Is that clear? About secondary prevention. Aspirin tablet 75 milligram administered to patient with suffering of hypertension with organ damage, cardiovascular disease, transient ischemic attack, problem in brain arteries, ischemic heart disease, angina pectoris, myocardial infarction, and hypertension with diabetic mellitus for old patient which age 50 years old and above. This about secondary prevention. Okay. Aspirin tablet 75 for Parkinson disease. We will talk aspirin 75 milligram daily. The body converts the aspirin to compound called salicylate, but activity of enzyme that has been indirectly linked to Parkinson disease. This enzyme called glyceraldehyde 3-phosphate dehydrogenase. Aspirin inhibit this enzyme. The role of aspirin tablet 75 milligram to treatment Alzheimer's disease. The mechanism of aspirin for Alzheimer's disease is the increase the urinary excretion of 11-dehydrothromboxane B2. Therefore, we have dehydrothromboxane B2. That is mean is present inflammation because this inflammation mediators. of aspirin tablet 75 milligram coated prevent pregnancy complication such as preeclampsia, obstetric antiphospholipid syndrome. Aspirin has based on restoration of prostacyclin and thromboxane 2 balance to the dominance for the former. Now let us go to the conclusions and references.
The conclusions: aspirin tablet 75 mg enteric coated gastro-resistant, Ucardit UK Limited. To prevent primary prevention of sudden cardiac death, primary and secondary prevention of cardiovascular disease, especially in patients with diabetes, cholesterol, and high blood pressure. Thrombosis, where aspirin as blood thinning. Peripheral vascular disease, impaired arterial blood flow to the legs. Arteriosclerosis and blockage, brain infections, Parkinson's disease, pregnancy complications. Protects you from risk of myocardial infarction and acute heart failure, risk of heart attack, stroke and angina, risk of coronary artery blockage, risk of developing Alzheimer's disease, risk of preeclampsia and premature labor. Effective treatment in cases of common cardiovascular disease or cardiovascular disorders. In case of stress and unstable angina, prevent the recurrence of heart attack and stroke, prevents recurrence of myocardial infarction in patients with stable coronary artery disease, is reconstructing the vessels after surgery, essential support for people who have had an operation or a stent inserted into the coronary arteries and after bypass surgery, inhibits the growth of tumor cells and limits their spread. A drug that helps fight cancer, breast, ovaries, prostate, skin, liver, esophagus, stomach, colon and rectum cancer. Prevents abortion if it's used daily for pregnant women in the first 12 weeks of pregnancy, especially pregnant women who are at higher risk of abortion. Aspirin enteric coated tablet 75 mg to protect the stomach, long acting, as it consists of many layers that are absorbed along the GIT. Composition: each enteric coated tablet contains 75 mg acetyl salicylic acid, aspirin. Dosage: 1 tablet once daily. For children not intended. Safe for pregnant women. The important note: consult a doctor before starting treatment. Aspirin 75 mg per day, standard dose, suitable for use in a long-term treatment. Dose not cause bleeding in the brain nor bleeding in the stomach and intestine. The best dose of aspirin to take 75 mg, which is less than standard infant aspirin. Aspirin tablet 75 mg enteric coated gastro-resistant is the first in Europe. We are proud to be the top choice for doctors.
Finally, this presenter of this presentation, Dr. Ali Kubati, greet you with my respect for you, Wukadet UK Limited team, and Al Mehdar Bruce Medical Corporation team. Also, I greet the cameraman, Mr. Tilha, as well as for all my audience of the ladies and gentlemen, and see you soon.